Hey everyone, this is Dr. Palvia and this is Lynda Gehrman, and we represent two different yet complementary approaches to orthopedic health here at Physiologic in downtown Brooklyn. Recently, we had a chance to work together. Lynda was actually one of my patients, and we were working together to strengthen and stabilize her hip. So just want to share some details about that and some takeaways that we believe all of you can benefit from. So, how you doing today?
I'm good.
Good.
Yes.
How you feeling?
I'm feeling good. If I didn't have to lift this heavy couch to make this beautiful frame we have here.
I feel like I was forced to do that actually.
What did I do to myself? What did I do? I know I did PRP, or you did PRP.
Right.
But how do you eloquently describe what that is?
Yeah, so very important. So orthopedics is a very wide specialty, but one very popular area that has really transformed my practice is regenerative medicine. And regenerative medicine basically is, the most popular therapies are PRP and stem cells, which are buzzwords that everyone has heard of. What exactly do they mean? In short, PRP is platelet-rich plasma. Platelets are cells in your body that promote healing. So for example, when you get a cut, why does it heal magically in 3 days? The reason for that is your skin is full of blood vessels. It's vascularized, as we say. And because it's vascularized, anytime there's an injury, your body senses that and sends these little cells called platelets to that site to promote healing. And these platelets then start these reactions where growth factors, oxygen, nutrients, clotting factors basically promote this awesome healing reaction, and your skin heals up in a couple days. But the problem in orthopedics is joints, tendons, cartilage, bones, the blood flow is very poor. So these areas don't really heal that well, and that's why you get chronic injuries in the orthopedic world. You don't get chronic skin injuries, usually speaking, right? Because everything heals nicely. But in the orthopedic world, hips, joints, knees, etc., they don't heal well. A little bit outside of the scope, stem cells is more for actually regenerating. So now you're talking about more significant injuries where you've damaged an area, you lost cartilage, arthritis, those kinds of things. A little bit outside of what we did, but just to give you a flavor of the two, that's what PRP versus stem cells are. So my question for you is, you are very athletic. I'm a little sad to say much more athletic than I am. And so someone who is in great physical form, and not particularly injured, why would you pursue doing something like platelet-rich plasma?
So I did, or Dr. Palvia did, my left hip 2 years ago for the same symptoms, and I feel like I do have the little bit of wearing of cartilage in the hip, and at a young age, and growing up dancing, and I still dance, there's these little misalignments that I have, like my right arch drops a little more than my left arch, my pelvis doesn't feel perfectly aligned, and I do so much precision work, not always exactly precise, and then over time I feel like I've created these little micro injuries, like you say.
Mm-hmm. And micro injury doesn't mean that there's actually something that can be detected by imaging.
Right.
You don't always need to have an MRI that shows damage for there to actually be damage, right?
Right. Oftentimes the MRI, it's like disappointing because you're like, wait, I thought I had no labrum at all.
Yeah.
But it's all relative to what you do. So for me, if I was just sitting on my couch all day long, I would definitely not know I had an injury. But to me, it feels like a really big injury because when I dance, I'm not able to be free. I call this my party leg, and I have these little movements that they surprise me, and they cause me pain, and I just think, why not feel amazing?
And as you said, because you have that, you tend to design your entire routine around that, right? So you're still favoring, and because of that, it ends up being like an injury, even though it's not a real injury.
Oh yeah, I spend a good 30 minutes to an hour at a pop, probably 5 days a week, just maintaining my hip, just making it stable and strong. And this has just become part of my life. And when I do mindful movement, it is fine, but it can be a little bit, you do mindful movement and you do this disciplined work so that you can be free and not think about it when you're actually doing what it is that you do. So, and that I'm not getting that freedom.
Right.
And so if I just added up those hours alone, it pays for the procedure.
And the concept here is we're not necessarily repairing something, but we want to strengthen it. So PRP is basically your body's glue. Again, back to the example of the skin, it heals nicely. It's like a magical glue. So, obviously there's science behind it, but the point is that if we can apply that glue to an area that's feeling weaker and a little bit more unstable, if we can tighten ligaments, tendons, promote better mechanics in that joint, then you can be where you want to be in terms of performance and functionality and so on and so forth.
Right. So then that's my question for you too, is the glue analogy works well for me because I try to work, and for dance and the things I love to do, I want full strength in full range of motion. So when I'm rehabbing this area, I have to be really thoughtful not to go past these points and to work on strengthening and stability and kind of like let that glue process happen. So what do you think is the best way to judge how to be eccentrically contracting muscles versus stretching muscles?
Yeah, so I think it's a little bit complex, and I spend a lot of my time coaching patients about this and leaning on my my rehab and fitness colleagues about how to deal with this. Back to the skin analogy. Imagine when we were kids and we got a little cut or even a big cut, right? What happens? A scab forms. And a scab basically is a representation of what the platelets are doing to promote healing in that area.
So don't pick the scab.
Exactly.
Okay.
So yeah, it's just like our parents told us when we were little, if you pick the scab, it won't heal properly. The same way, if I am treating you with PRP, I'm basically forming a massive scab in the affected area. In order for that scab to heal properly, you cannot really disturb it. And so I think that has to be the greatest mindset shift that a lot of my athlete patients and even otherwise have to understand, is that there's a healing process just with any treatment that has to go through to completion to see the best results. So with respect to rehab, in the beginning, I usually recommend gentle stretching. You don't want to disturb. For example, if we're treating a tendon, or in your case, a labrum, right? Sorry, I hope I didn't give away your history too much. But basically, if a labrum is affected, if you do intense stretches, intense motions, sudden motions, you're really going to disturb that structure that's trying to heal. So in the beginning, it's very gentle movements. Some of it is just recovering. So even a couple days rest in the beginning. Let the product settle in. Let your body kind of get acclimatized to what's going on. I think that's really, really important.
Yeah.
And then everyone's recovery is different. So, someone who is used to moving and used to protecting an area that's injured may be able to rehabilitate a little bit more quickly through that, understanding that you can still move without disturbing that area. Whereas someone who may not be more athletic type, that person may have to have a little bit more supervision in terms of what types of exercises to be doing while they're rehabilitating. But usually with PRP, it's a little bit of a long game. The more that you put into it, the more you're going to get out of it going forward. And I think we can say that for your left hip when we treated a couple years ago.
So I have one big question. So I treat athletes and dancers and movers every day. We are used to always having an injury, micro, macro, acute, chronic. It's normal. And we find these ways of moving around them that are just fine. And we can go on for decades that way. But how do I and how do you encourage people and athletes, and honestly, everyone's an athlete, especially if you live in New York City, everyone's an athlete, schlepping around. But to not feel like you're a hypochondriac, right? Like to not feel like I'm going to the doctor for this thing, and not waiting too long. So it's preventative might be one word for it, but I think going into see someone like you and look at images and kind of do orthopedic testing and see, because then you'll have more longevity. Like you don't want to peak when you're 20 and then be sitting on your couch talking about the things you used to do when you're 50. Like, how do you judge on when to go see you?
Yeah, so I think with my patient population, there are no hypochondriacs. I think everyone can be optimized to some degree, and I think at Physiologic, that's what we believe in collectively. I think that's how we work together. I always joke with my patients, but it's true. We're all falling apart slowly. From the moment we exit the uterus, we're falling apart slowly.
No.
There is something, I can at least say for myself, I am not moving perfectly. And so there's something that is being overused. There's something that is being affected with my day-to-day movements. And as you said, even New York's turned me, I'm much more physically, my physical activity, I try to pay a lot more attention to it than I used to, let's say 10 years ago. I think that's a product of our area, our the way we live, our mentalities. But I think it applies to a wide population, not only in New York, but even outside of New York. So I don't think there are really any hypochondriacs in the orthopedic world, simply because, everyone has their sort of Achilles heel, so to speak, and everyone can really try to push through whatever needs to be done to increase that performance. So no hypochondriacs in the orthopedic world. I think an assessment always starts with a history and a physical and setting expectations. So, athlete types, doc, I want to run twice as far as I'm running. I want to jump higher. I want to lift more, etc. And we focus here at Physiologic again on what the mechanical vulnerabilities are that are preventing that. So from the medical realm, even if it's not a big injury or macro injury, as I like to say, what's the functional limitation, right? So again, is it some kind of impingement in the hip, or is it an unsteady knee, or is it some mechanical issue in the shoulder or in the spine that's causing problems further downstream? So to answer your question, I think there is, for those who are chasing performance, I think there is a lot of utility in this type of science. I think it's applicable both in injury, but as well as preventative, so to speak, or even performance enhancement. I think it applies to all those areas, and I think our patients benefit from that accordingly. Before we wrap up, I just want to ask you about your experience. So, people are like, oh, this is the needle guy, this is barbaric, what's going on? So can you talk a little bit about what your experience was? Was it difficult? Was it painful? Those kinds of things.
Yeah, I thought it was great. My first time when I did the left side, I had a little more anesthesia than the second time by my choice. And so
I'm a generous bartender. What can I say?
Yeah, and so I felt a little more of the procedure happening, which I welcomed because I think it's interesting. And I wanted to know exactly where he was. And there's how many injections you did? 16?
Depends on the body part, but yeah, in the hip it's somewhere between 15 and 20, depending on what we're dealing with.
Around the whole circumference. And I was on a crutch for like a day. And after that, I think now, and for the past, because it was about 10 days ago that I did it or so, I feel sore, but the soreness feels like it's doing what it's supposed to do.
Just like a scab or a bruise is sore,
exactly,
same kind of thing.
Yeah. So I'm trying to be very, very mindful and like gentle. So that I want to keep working for me for a long time. And I feel like I'm coming upon this stage where I'm going to want to see the chiropractors and the physical therapists to get their eye on me and work on my sacrum and all of the things that affect the hip joint. So with any hip injury, I always think when I work on other people and myself, it's like so much feet and glutes, and it's like getting all of that and the pelvis aligned. And so I kind of want to start looking all around the area to see, because it's always about getting to the root of stuff, right? So I know the little things I did that kind of caused it. So now I'm at the stage where I want to dig in. Yeah, and for those out there who are wondering, for someone who's not injured, what exactly are we doing? So a lot of it is mechanical improvement. So for Lynda, what exactly were those 16 injections? If you go, before the thinking was just dump some platelets in the joint and that's it. But in your case, we're using that body's glue, the PRP, to tighten all of the supporting structures. So of course the labrum is important for stabilization, but we treated all of your tendons as well. So your hamstring tendons, your glutes, your piriformis, your adductors, IT band, just to name a few. So it's really treating not only the joint, but the entire area, and that's what we did. And I find that especially for performance, the results are far superior than just treating intra-articularly. So I think that's pretty much it. Yeah. It was a pleasure talking to you, Lynda, and I hope everyone found this to be informative. Please
feel free to reach out if you have any questions.
Yeah, ask questions.
Drop a comment in the comment section down below. Did I say that right?
I think so.
Okay, and we're looking, hopefully if you guys find this informative, we will continue to do this kind of series.
Yeah. Why not feel amazing?
Yes, why not feel amazing?
Why not feel amazing?
All right, wrap it
Nice.
up?
Yep.
Okay, good.